We are all on the run during these summer months, but painful vein disease can actually slow us down. Well, Dr. Robert Cutchen, founder and director of the Albuquerque Vein and Laser Institute, is back to tell us how we can learn to love our legs again.
That's
Welcome
right.
back.
Thank you. It's great to be back.
Oh, it's good to see you. And of course, this time of year especially, we all really think a lot about our bare legs and being seen. So tell us first more about the Albuquerque Vein and Laser Institute and what we can expect when we come in there.
All right, we've been in our we're in now our fifth year at Albuquerque Vein and Laser Institute. It's a clinic that I opened in 2009, and we are devoted 100% to the diagnosis and treatment of vein disease. And primarily what we do is treatment of varicose veins and spider veins, although we do some other things, treatment of, or diagnosis and treatment of blood clots and stuff like that. But most of what we do are those pesky varicose veins.
And it's a lot more common than I think a lot of people realize.
It really is common. It's estimated that between 15 and 25% of people have varicose veins to some degree.
Wow. Well, so what exactly are varicose veins then?
Varicose veins are essentially broken veins, veins that aren't doing their job. The job of our veins is to carry the blood up and out of our legs back to our heart, so our heart can pump it all over again. And varicose veins are broken veins where the little one-way valves in the veins are broken, and the blood actually flows backwards towards your feet in a varicose vein, and that ends up causing your legs to feel uncomfortable.
Sluggish.
Yeah.
So what are some of the symptoms then that we should look for so that we know that we have varicose veins?
Most commonly, people complain of their legs feeling heavy, achy, tired. Some people complain of burning or itching, throbbing. And for some people, they will see bulging varicose veins on their legs, but other patients will just have the symptoms and their legs may look completely normal. So just because you don't see bulging veins doesn't mean that you don't have varicose veins.
That's a good point, because I don't think a lot of people would realize that. They think to look first. So then this is something I really want to ask you, because obviously when we come to the center, we get treated. So how has vein treatment changed and evolved over the years?
It's really changed pretty dramatically, and probably the biggest change is that treatment has gone from the hospital to the office. And so everything that we do now is done in the office. And
comforting, actually.
It is, it's good. And we do all of our work up in the office. So one of the great things about our clinic is we're kind of completely self-contained. Our patients come, and the key to successful vein treatment is successful vein diagnosis, and that's all based on ultrasound. And we do our ultrasound in our office. And so we can get everything figured out kind of on day one, and our patients don't have to run around town getting this done and that done, and we can get it done in the office and figure it out.
Convenient. I mean, that really does make a big difference, and you and I have talked about that before, but I think people really need to understand that if they think they might be having a problem, it's so worth your time because you do make it convenient for them. And I think that results obviously speak volumes as well. Can we take a look at some results?
Yeah, I brought in a few pictures I wanted to share with your viewers today, just to kind of show a few before and after pictures. And
what a difference.
Most of these pictures are about 6 months out from treatment, and most of our patients undergo a variety of different treatments, but these pictures are always impressive when you can show some bulgy veins that are now gone.
That's a huge, oh my goodness, look at the difference there. Wow. And so now this obviously is a more visible varicose vein situation.
Yes.
So you come in and you say, look at my legs and how can you help me? And how long would it take to see these kind of results that we're looking at right now?
The pictures of the bulgy veins are typically, most of those pictures I took probably 2 to 6 months after we treated them. This is a picture actually of spider vein treatment, those real fine blue or purple veins or red veins that people get on their, just right on the surface of the skin. These are very small. This picture is actually about 6 or 8 months later. And this was just a really great result from a patient that we treated last summer.
Wow.
And so that's another aspect of what we do, is kind of more that cosmetic treatment of those spider veins that people are thinking about a lot right now during the summertime when they're wearing shorts and swimming suits.
Definitely. For them to know that they can look like that, it's worth it. It is absolutely worth it. So how can the viewers contact you?
We can be reached on the phone at 848-VEIN, and you can also find us on the web at albuquerquevein.com with a lot of explanations about how we do vein treatment and information about our office.
Great. Dr. Cutchen, thank you. It's great to have you here. And
thanks again.
Thanks for helping out to make our legs look better. We appreciate it.
Thank you.